Welcome to another edition of South Sound Business Report. I'm Jeff Rounce.
And I'm BE Editor Mike Boyd.
And I'm Emily West. On today's program, we look at some new tools and trends in healthcare. Stay tuned.
From a broad perspective, it's been argued that computers revolutionized the 20th century, at least through its final 15 to 20 years. And many suggest that robotics will have the same magnitude of impact in our new 21st century. With two distinguished guests from the medical community, we'll be well equipped today to have a discussion about how technology is bringing change to operating rooms throughout the South Sound and the breadth of American hospitals. But first, Emily talks with BE Editor Mike Boyd about a business story from the South Sound.
Thanks, Jeff. Mike, I'm curious, from your standpoint as the editor of the Business Journal, you're really at the pulse of a lot of what's going on in South Sound business, and healthcare is one of the big focuses of the paper. What are some of the trends that you're seeing that are happening, affecting our area right now?
Well, one of the big trends is the anticipated shortage of doctors nationwide. In the next 15 years, they anticipate that we'll be lacking 150,000 doctors.
Wow. That seems like it's, I mean, just in our area, 150,000 doctors, or?
No, that's throughout the nation. And in the South Sound, we actually may be a little better off if some recent happenings are any type of harbinger for what's to come. Providence St. Peter Hospital down in Olympia, their most recent class of residents, the majority of those graduates are going to stay in the South Sound and practice medicine. So that bodes well for the community.
What are some of the reasons why we might be seeing shortages? It seems like healthcare is certainly an area where there's a demand.
Well, there's increasing demand in healthcare, but one of the things is that reimbursements from Medicare and things like that are going down. And of course, costs are rising. Costs such as medical malpractice insurance for doctors. Also, lots of doctors are going into specialties. There aren't a lot of primary care physicians. So there really is an emphasis on trying to get doctors to be primary care providers.
Is Washington, is there any special kind of things that are going on in Washington? I know that our healthcare policies, particularly around malpractice insurance, maybe are a little bit different than other states. Is that affecting us more than other places in the country?
It doesn't really appear to be affecting us more. All of the issues within healthcare are issues that are really nationwide that everyone's going to have to address. The issue of more primary health physicians, the state and the federal government offer incentives to some specialty doctors to practice in rural areas, places like that, so that they can attract physicians. There really aren't any incentives that are given to primary care physicians.
Seems like it makes a lot of sense. I mean, everything that we're seeing in the new healthcare bill is really around making preventative measures a little bit more accessible. Are we anticipating that there will be more clinics open by the hospitals, or how the trend, how will that trend affect us?
Well, as the need and the demand for healthcare increases, they're going to have to open more places so that people can access that care. That's one of the worries with the new healthcare bill, is that there are going to be so many people who are accessing that care that there just aren't going to be enough healthcare professionals to provide that care for them. So that's something that they're going to have to work out, and hopefully they'll be able to take care of that.
Well, thanks, Mike, for your perspective. We appreciate it.
Sure.
You can read more about South Sound healthcare issues in the Business Examiner, and we have more local stories each weekday at businessexaminer.com. We now turn to technology and its ever-growing presence in our lives. We mentioned robots at the beginning of the program, and one example is unmanned aerial vehicles. They're pilotless mini airplanes in the skies over Afghanistan or Pakistan. They're often flown by computer operators in Las Vegas or generally some other remote spot in the United States. There are other uses of robotic technology right here in the South Sound, increasingly being used in hospital operating rooms. Most prominent is this Da Vinci surgical system robot, shown during a training session at Franciscan St. Joseph Hospital in Tacoma. Much of the technology was developed for the U.S. military because the Army wanted a way to perform battlefield operations without physically endangering the surgeons. The solution? Surgery done via remote control, with a doctor in one location, the robot and patient in another. The Pentagon's contractor eventually sought civilian applications for this technology, and here we are. Jeff has two guests to pick up the conversation about how technology is bringing change to healthcare in our region.
Thanks, Emily. We have two guests with us on the program now who will talk about the healthcare world. In particular, we'll start with a conversation about some of this technology. At the far end is Dr. Mark Adams. Dr. Adams is the Vice President for Medical Affairs and the Associate Chief Medical Officer at the Franciscan Health System. Dr. Adams is board certified in general surgery and vascular surgery, had many years in private practice. Today, his responsibilities are working with the Franciscan's 5 hospitals in Pierce and King counties, as well as medical clinics back in Kitsap County, where you came from, too. Between us is Dr. Claire Spain-Remy. She is board certified in obstetrics and gynecology and practiced for more than 20 years before becoming the medical vice president for specialty care at MultiCare Health System, also headquartered here in Tacoma. In this role, she oversees MultiCare specialists such as orthopedic surgeons and neurosurgeons. Dr. Spain-Remy is also, among other things, a senior fellow of the American Leadership Forum, Tacoma-Pierce County. Glad to have you both here. Dr. Adams, would you set the stage and follow up to kind of explain what is this robotic surgery concept that we were looking at?
Well, the Da Vinci robot is a device, basically, that's designed to enhance surgical procedures. It's a way for surgeons to do an operation that's minimally invasive, so small incisions, small scars, but also to do fairly sophisticated surgery, complex surgery, in a way that otherwise can't be done as easily or without making a big incision. So it basically, it enhances the vision because it's magnified, and it enhances dexterity because it provides a very fine motor control to allow very precise movements and surgical procedures.
So when we say robots, we might be thinking of the videos or the movies we've seen about the automobile manufacturing lines where they've got all these machines going in and doing a pre-programmed thing. What you're talking about is the surgeon is actually controlling in real time the device, am I right?
Right, it's important. It's not R2-D2 doing the surgery. It's not the robot doing the surgery. The surgeon basically is sitting at a console near the patient and manipulating all the controls. It's really just enhances the surgeon's ability to perform, but the robot doesn't do the surgery.
And Dr. Spain-Remy, I'm told that you have performed robotic-assisted surgeries in the past. How long has this device, how long has this technology really been used in American hospitals?
You know, it's been in our community since about 2005, and certainly it's technology that came from the military, so it's been used outside of this area longer than that.
So the device, as Dr. Adams described it, has a camera inside the patient's body in some cases?
Yes. It has a camera inside, as well as arms that can be manipulated and using different instruments. And there's an assistant that stands at the side of the case that does some of the positioning of things for the surgeon. And then the surgeon sits in a console that gives them three-dimensional vision and gives them the full manipulability of what their hands would be. And with laparoscopic surgery, which was the precursor to this, you could use surgical instruments and you could rotate them, you could move them up and down and in and out, but you couldn't bend them. So these actually mimic the movements of your hands and wrists and give you full capability within the patient from the console.
What you don't have, though, I would imagine, is a sense of touch, because you're holding a physical machine object.
That's true. That's the one thing that you lose with the robot, is you can't feel the sensation of whether something feels tight or loose, and you can get some of that feedback from your surgical assistant because they're actually holding on to things that have that sensation.
Dr. Adams, what's the objective here? Is this a step forward, or is it technology because somebody invented it and somebody bought it? Is there an advantage to using this?
Well, it's a step forward because it does provide minimally invasive, technique that is better for the patient because they recover quicker. There's less pain, less distress. It's really a more efficient way. Usually there's less bleeding, and so fewer complications, fewer infections. And so it is definitely an advance. It's not for all procedures. There are some procedures that will continue to be done open, traditional, old-fashioned way. There's some procedures that are done laparoscopically that work very well still. But for very certain types of procedures, it really is a huge step forward.
Which types in particular has it been used with?
Well, it's particularly good for areas that are hard to reach in the body and fairly localized. So, for example, gynecologic procedures, prostate surgery, is a good example. There's certain general surgical procedures that can be done with it, and certain chest procedures, like in the middle of the chest, where it's very hard to get to with an incision, and so it provides access that way.
And what has your experience been? Is it a step forward?
I think it's absolutely a step forward, but I do caution as well that it's not for every patient and it's not for every case. I specifically remember a patient who was self-employed who needed to have a hysterectomy and had a very large uterus and asked me if I could do this minimally invasively. And I was able to do her surgery through 4 very small incisions, and she was able to go home the next day. She had minimal blood loss, and so she wasn't anemic when she went home, and she was back to work in 2 weeks. So it's certainly for her, it was a huge improvement.
So that's one of the keys, is it's less disruptive to the everyday life of the patient.
Yes.
Yes.
And because the incision, the hole in the body, which can be much smaller.
Yes.
And other benefits from a smaller incision would be?
Less pain.
Okay.
Shorter hospital stay. Less chance of having disruption to bowel function, so patients are able to eat and have normal intestinal function sooner because you're not manipulating their bowel as much during the surgery.
Small scar, too.
Okay.
Yeah.
Is there a disadvantage to it? Is there something that that would cause the surgeon in consultation with the patient to say, this is not an appropriate procedure to use these?
There certainly are some limitations. With very large patients, it can be very difficult because of the length of the instruments that are involved. And it may be that approaching it in this fashion could prolong the surgery significantly, that could increase the risk of complications from the surgery to the patient. And so you always have to weigh that in deciding who the best surgical candidate is.
From the perspective of the surgeon and the rest of the operating room team, is this easier? Is it less stressful? What's the impact there?
Well, there's a balance, and again, it's a balance between is it more effective or not, depending on a number of factors. But it takes more skill, and so there is more for the surgeon to learn. It also takes a certain maintenance of skill. So this is not one of those things you just go out and learn it and then do one now and then. You really have to be committed to doing it over and over again to maintain proficiency. And so in that sense, there's some stress involved with that. I think for the operative team, not all of the operative team can do it. And so again, people have to have special skills and special training to do it. And so, it's not for everything. And so,
where does that training come from? Is it something that doctors coming out of medical school and residency training or whatever, are they arriving with the skilled use of a device?
Well, many people today are arriving with the skill, although even basic residencies don't always have it. Sometimes it requires an additional training, a fellowship, we call it. But we try to get more and more, I think, people coming out of training so that they've had a greater breadth of experience. It is possible for a practicing surgeon to go back and learn how to do it. But again, there's a steep learning curve, and so it takes time, and it takes also proctoring. So once someone's trained, when they come back, we don't just let them dive in and start doing the surgery with the robot. They have to spend time with a trained, skilled surgeon who watches them and helps them and mentors them to be sure that they develop the skills properly. So it's not for everybody.
I would say, too, that even though there are more surgeons coming out of training who have been exposed to this during their residency, the volume of cases that they've done where they've actually been the primary surgeon is low. And so most of them we're finding come out and do need to do proctoring with a surgeon who is experienced with this, although a little bit more likely to have that if they've done a fellowship. So.
You mentioned, Dr. Spain-Remy, that they came to the South Sound about 5 years ago or so. Is this technology widely spread now? Is it in most hospitals of a particular size?
Well, in our area, it's in almost every hospital in the region. So yes, and there are several hospitals in Seattle that have the capability as well.
So if, in fact, it's here in multiple opportunities, are each team getting enough practice? Dr. Adams, you mentioned it's something that you can't just play one round of golf a year and shoot par. You need to do a lot of it. Are your teams getting enough use of this equipment?
Well, I think that's a challenge for us. Both of us have that challenge of trying to make sure that we concentrate the cases, whatever that number is, in the right number of surgeons so that they do maintain their proficiency. We recently changed actually our rules in our hospital system, in the Franciscan system, and I believe it's similar in MultiCare, and that is that we now check every year to make sure that those surgeons do a certain number of cases, and if they don't, then they have to stop. And so one way or the other, either through that mechanism